One nose, 1,000 ways to change it, from the tiniest tip tweak to a full reconstruction. Today, we're breaking down every single type of nose job and the celebrity transformations you've never noticed. We'll show you side-by-side comparisons so shocking, you might never look at red carpet photos the same way again. And yes, we're naming names. By the end of this video, you'll be able to spot an open versus closed rhinoplasty, tell if someone's had a tip plasty, and even know when a nostril base has been shaved down. All without a surgeon's degree. Let's get started. Chapter 1. The Nose Job Basics. What people don't realize. The idea of changing your nose is not new. Historians believe the earliest nose reconstructions date back over 2,000 years in ancient India, where surgeons repaired noses using cheek flaps, often after injuries or punishment amputations. Fast forward to Hollywood's golden age, and the nose job went from medical necessity to a beauty industry secret weapon. Stars like Marilyn Monroe and Rita Hayworth allegedly refined their noses to fit the camera's unforgiving close-ups. Back then, it wasn't discussed. You didn't admit it, you just had a glow-up. Today, rhinoplasty comes in two main flavors, functional and cosmetic. Functional rhinoplasty is about fixing a breathing issue, like a deviated septum. Celebrities such as Jennifer Aniston have spoken openly about theirs, insisting it wasn't for beauty. Cosmetic rhinoplasty, on the other hand, is purely aesthetic. Think Bella Hadid or Blake Lively, where the main goal is proportion, symmetry, and yes, a little red carpet magic. Here's the thing most people don't realize. Not every nose job is obvious. Some are so subtle even superfans miss them, until you compare an old Candid to a high-definition press shot years later. Meghan Markle is a perfect example. Compare her early acting headshots to her 2018 royal event photos, and you'll notice tiny changes that soften and refine her features without screaming surgery. The modern trend? Less completely new face and more, was it just good lighting? With techniques designed to blend with natural bone structure, not fight it. But that doesn't mean the surgeries themselves are simple. From open versus closed approaches to cartilage grafting to millimeter-perfect nostril reshaping, the options are endless. And that's exactly where we start, because the way a surgeon even gets inside your nose determines everything that follows. Chapter 2. Open versus closed rhinoplasty. When most people imagine a nose job, they picture a surgeon making one small cut and magically sculpting the perfect nose. But there's a big decision that happens before the first millimeter of bone or cartilage is touched. Whether to go open or closed. Open rhinoplasty involves making a tiny incision on the columella, the strip of skin between your nostrils. This allows the surgeon to lift the skin and fully see the internal structures of the nose. Think of it like opening the hood of a car and everything is in clear view. It's the preferred choice for complex cases, major reshaping, or revision surgeries. The trade-off is a slightly longer recovery time and, in rare cases, a faint scar along the columella, though it usually fades until it's nearly invisible. Closed rhinoplasty keeps all the incisions hidden inside the nostrils. The surgeon works without lifting the skin completely, relying on skill, experience, and tactile feel to reshape the nose. Because there's less disruption to the tissues, swelling tends to be lower, and recovery is often faster. The catch? The surgeon's visibility is limited, so it's generally better for more straightforward cases or subtle adjustments. Open surgery is like renovating a house with all the walls knocked down. You can redesign every inch. Closed surgery is more like rearranging furniture in a furnished room, faster and less invasive, but with constraints. Some celebrity transformations give away which method was used. Patrick Dempsey, for example, had significant reshaping that likely required the open approach. Kylie Jenner's alleged refinement also points toward open rhinoplasty. Her bridge, tip, and nostril area all show changes that would be difficult to achieve through a closed approach. On the subtler end, Scarlett Johansson's long-rumored nose tweak is a good example of what could be done with the closed method. The changes are delicate and maintain the natural architecture of her original nose. Natalie Portman's rumored adjustment also fits the closed approach style. Minimal invasiveness, maximal subtlety. Here's a twist most people don't know. A surgeon might start with a closed rhinoplasty plan, but switch mid-surgery to an open approach if they discover more structural work is needed. In other words, even if you go in expecting the less invasive method, the final decision often comes down to what's discovered once the surgeon is inside. Choosing between open and closed isn't just about scar or swelling. It's about matching the surgical plan to the changes you want. The bigger the transformation, the more likely an open approach will be on the table. The more subtle the adjustment, the more a closed approach might fit. And in the right hands, either one can be invisible to anyone but the most eagle-eyed fans. Chapter 3. Tip Refinement, Tip Plasty. If the bridge of the nose is the stage, the tip is the star of the show. It's the part people focus on when you're face to face, and even a 1 millimeter change can alter how the whole face is perceived. Tip refinement, or tip plasty, is the art of reshaping only the nasal tip while leaving the rest of the structure untouched. Some people naturally have bulbous tips, round and wide. Others have drooping tips that point slightly downward when they smile. Tip plasty targets these issues without altering the nasal bridge or bone structure, making it one of the most subtle yet powerful forms of rhinoplasty. The technique involves reshaping the cartilage that forms the tip. This can mean trimming excess cartilage, using fine sutures to pull and refine its shape, or adding tiny grafts to improve projection and definition. Unlike full rhinoplasty, tip plasty often has a quicker recovery, though swelling in the tip can linger for months, sometimes up to a year and a half before the final shape settles. Meghan Markle is often cited as an example of subtle tip refinement. Her earlier acting photos show a slightly rounder tip, while later public appearances reveal a more defined, softly contoured shape that blends perfectly with her natural features. Zendaya is another star whose tip has sparked speculation. Her profile remains the same, but the tip appears more sculpted and precise than in her early Disney days. Whether through surgery or expert contouring, the effect is delicate yet striking. Tip plasty is also a favorite among younger patients who are not looking for a dramatic change, but rather a polish. It's popular among those in the public eye because it can create the impression of better symmetry and proportion without the telltale signs of a full nose job. One of the fascinating things about tip refinement is how much it influences perceived personality. A lifted, defined tip can make a face appear more youthful and open, while a drooping tip can sometimes be read as older or more severe. That's why in red carpet close-ups, even a tiny change to the tip can have a big visual payoff. In the hands of a skilled surgeon, tip plasty can be almost impossible to detect, which is exactly why it's one of Hollywood's best-kept secrets. Chapter 4. Bridge hump removal, dorsal hump reduction. The dorsal hump, that bump or ridge on the bridge of the nose, is one of the most requested changes in rhinoplasty. For some, it's genetic. For others, it's the result of an old injury like a sports accident or a childhood fall. Either way, removing or reducing it can dramatically change a person's profile. Dorsal hump reduction isn't just about shaving down bone. The hump is usually a mix of bone near the top and cartilage closer to the middle of the bridge. A skilled surgeon carefully smooths both while keeping the natural lines of the nose intact. Go too far, and you risk creating what's known as a ski slope nose. Overly scooped and unnatural. Leave too much, and the change is barely noticeable. Some celebrities have famously refined their dorsal humps. Jennifer Grey's post-Dirty Dancing rhinoplasty remains one of the most talked about in Hollywood history. She removed a prominent hump, and the change was so dramatic it altered her recognizability. Others, like Gigi Hadid, are rumored to have undergone very subtle hump reduction, leaving just enough character in the bridge to keep their face unique. Even male celebrities opt for hump refinement, though the goal is often to soften rather than completely erase it. Zac Efron's profile, for instance, appears slightly straighter in more recent years while still keeping a masculine edge. Here's what many people don't realize. Some patients actually add a tiny hump back in, after surgery using fillers if they feel the bridge is too flat. It sounds counterintuitive, but in facial aesthetics, a completely straight bridge isn't always the most flattering. Sometimes a microcurve can keep the face balanced. In Hollywood, the hump is often reduced just enough so the profile reads as smoother on camera, but not so much that it erases ethnic heritage or natural character. It's the difference between someone saying, "Wow, you look amazing," and "You look different." When done right, dorsal hump removal can transform a side profile into something red carpet ready, while still making people wonder, did they or didn't they? Chapter 5. Alar base reduction, nostril narrowing. The width of your nostrils, the alar base, is one of the smallest parts of your nose, but it plays a huge role in overall facial harmony. Sometimes people feel their nostrils are too wide or flared, especially when smiling or breathing, and that's where Alar base reduction comes in. This procedure involves making small incisions at the base of the nostrils and removing tiny wedges of skin and tissue to bring the nostrils closer together. The goal isn't to make your nose unnaturally narrow, but to balance it perfectly with your other facial features. Celebrities who have subtly undergone Alar base reduction include Kelly Rowland, whose nostrils appear noticeably slimmer compared to her earlier photos, and BTS's J-Hope, whose nasal base looks refined without losing natural ethnic characteristics. In some cultures, narrowing the nostrils is especially popular because it softens the facial features and creates a more delicate profile. What makes Alar base reduction fascinating is that even a few millimeters can change how your nose casts shadows on your face, impacting the way light and camera angles play with your features. This is why it's common to see close-up comparisons showing slight nostril narrowing that make a big difference on red carpets or in photo shoots. Because the incisions are tiny and strategically placed, the resulting scars usually fade well, and recovery tends to be quicker than more extensive nose jobs. Still, precision is key. Overdoing it can cause breathing difficulties or an unnatural look. Alar base reduction is often paired with other rhinoplasty procedures, like tip refinement or bridge reshaping, to achieve a balanced and harmonious result. But when done alone, it's a masterclass in how small tweaks can deliver big aesthetic wins. Chapter 6. Augmentation Rhinoplasty, Implements and Grafts. While many people think of rhinoplasty as removing or reducing parts of the nose, augmentation rhinoplasty is all about adding volume and height to create definition and balance. This is especially popular in Asian rhinoplasty trends, where the natural nasal bridge may be lower and a more pronounced profile is desired. Augmentation can be achieved using implants made from materials like silicone or Gore-Tex, or with grafts taken from the patient's own rib cartilage. The choice depends on the desired result, the patient's anatomy, and surgeon preference. Celebrities like Park Min-young and CL are often cited in conversations about augmentation rhinoplasty. Their noses display a refined bridge and a tip that projects gracefully, enhancing their overall facial symmetry without looking done. But augmentation rhinoplasty carries unique risks. Implants can sometimes shift or be rejected by the body, requiring revision surgery. Because the nose is delicate and constantly moving with breathing and facial expressions, achieving a natural look takes both skill and artistry. One interesting trend is combining augmentation with tip work, where the surgeon lifts the tip and builds the bridge simultaneously to create a cohesive silhouette. This avoids the ski jump look where the tip and bridge seem disconnected. For many patients, augmentation rhinoplasty is a transformative procedure that adds confidence by creating a nose that fits their face perfectly, raising their profile both literally and figuratively. Chapter 7. Revision Rhinoplasty. Revision rhinoplasty is the challenging art of fixing or improving a previous nose job. Sometimes called secondary rhinoplasty, it's often more complex than the first surgery because the tissues inside the nose have already been altered and scarred. Patients seek revision for many reasons: dissatisfaction with the initial cosmetic result, breathing difficulties caused or worsened by surgery, or structural problems like nasal collapse. Because each surgery removes or reshapes cartilage and bone, there's less material to work with in subsequent procedures, making the surgeon's job much harder. Jennifer Grey's famous transformation after her original rhinoplasty is a well-known example. Her first surgery dramatically changed her appearance, and the results were so different that she reportedly had difficulty finding acting roles. Her later revision softened the look and brought back more natural features. Another example is Michael Jackson, whose multiple nose surgeries became public and part of his complex personal story. Each revision attempted to refine or repair the previous changes, showing how delicate and demanding these surgeries can be. Revision rhinoplasty requires a surgeon with deep expertise in nasal anatomy and reconstructive techniques. They must balance cosmetic goals with restoring function and structural integrity. Sometimes cartilage grafts from the ribs or ears are needed to rebuild lost support. For patients, revision surgery means longer healing times, careful expectations, and sometimes multiple procedures over years. But for those unhappy with their initial results, it offers hope, a chance to correct mistakes and find harmony both in appearance and breathing. Chapter 8. Non-surgical nose jobs, fillers and threads. Not everyone wants to go under the knife. And thanks to advances in cosmetic technology, non-surgical nose jobs have become a popular alternative. Using injectable fillers like hyaluronic acid or nose threads, these procedures can reshape, lift, and smooth the nose without any incisions or downtime. Liquid rhinoplasty with fillers is ideal for people looking to correct minor bumps, asymmetry, or to add subtle height to the bridge. The procedure typically takes less than 30 minutes, and results can last anywhere from 6 months to 2 years depending on the filler type. Celebrities such as Ariana Grande are rumored to have tried liquid rhinoplasty before committing to surgery, using it as a way to preview changes or make small tweaks. On Instagram and TikTok, countless influencers showcase their transformations with non-surgical nose jobs, making it a trendy and accessible option for many. Nose threads, which use tiny dissolvable sutures inserted under the skin, can lift and contour the tip or bridge. While the effects are not as dramatic as surgery, threads can add definition and a subtle lift with minimal recovery. However, non-surgical nose jobs come with their own risks. One of the most serious, though rare body complications is vascular compromise, where filler accidentally blocks a blood vessel, potentially causing tissue damage or even blindness. That's why it's critical to choose an experienced injector who understands nasal anatomy thoroughly. While non-surgical options offer speed and convenience, they can't replace the long-lasting structural changes achieved with surgery. But for many, they provide a low-risk way to experiment with new looks or maintain results between surgical procedures. Chapter 9. Choosing the right nose job for you. Deciding on the right type of nose job isn't just about copying the latest celebrity trend or picking a look you saw on Instagram. A successful rhinoplasty begins with understanding your unique facial structure, ethnicity, lifestyle, and personal goals. Surgeons evaluate a patient's face as a whole, examining proportions, angles, skin thickness, and nasal function. For example, a nose that looks perfect on one person might feel out of place on another because it disrupts facial harmony. This is why surgeons avoid one-size-fits-all noses and instead tailor each procedure to the individual. Ethnicity plays a key role in planning. Preserving ethnic features is increasingly prioritized to avoid the overdone look. Many patients want to enhance their natural beauty without erasing cultural identity. Many celebrities use morphing apps or 3D imaging before surgery to preview potential outcomes. This technology helps set realistic expectations and guide surgeons in planning. Cost is another factor. Prices vary widely depending on surgeon expertise, location, and procedure complexity. But remember, rhinoplasty is an investment in confidence and health, not just aesthetics. The photo trap is a common pitfall, choosing a nose based on how it looks in photos rather than real life. Lighting, angles, and filters can distort appearances, so it's vital to rely on professional guidance and realistic visualizations. Ultimately, the right nose job is one that feels authentically you, balancing function, beauty, and confidence. Your surgeon's skill in customizing the procedure is what turns a nose job from a celebrity copy into a personal masterpiece. Chapter 10. Final montage, then versus now. Looking back at all the celebrities we've talked about, one thing becomes clear. Rhinoplasty is as much about evolution as it is transformation. Faces change, styles shift, and beauty standards evolve over time. From Marilyn Monroe's subtle refinements to Zendaya's modern minimalism, from Jennifer Grey's dramatic reinvention to BTS's J-Hope's delicate balancing act between cultural pride and aesthetic enhancement, each nose tells a story. What's fascinating is how many of these changes walk the line between natural and enhanced. Sometimes a tweak here, a shave there, or a slight nostril narrowing creates an entirely new vibe without losing the essence of who someone is. Remember, what's considered the perfect nose today might look dated a decade from now. Trends come and go, but confidence and comfort in your own skin are timeless. So next time you see a red carpet photo or a viral TikTok, look a little closer and see if you can spot which kind of nose job they might have had. Which transformation shocked you the most? Drop a comment below. We want to hear your thoughts.